I am very excited about our next two presenters. They are Christopher Collins and Sophie Novack. Both are editors at the Texas Observer. And Christopher is based in Abilene, and he focuses on rural Texas. Sophie is a transplanted Northeasterner who focuses on public health. And they recently did a series of articles based on access to medical care and the hurdles and trials and tribulations of rural medicine. Now, it was called Critical Conditions, and I myself used it as part of a training module that I did with pre-med students to acquaint them with the realities of critical conditions, which was the title of the series, and the struggles and also the rewards of rural medicine. And they are coming today to talk to us about things that they have learned through this process. And we welcome you today. Take it away.
Yeah, thank you so much for that introduction. That's great. I'm so happy that you enjoyed the series and found that useful. I am going to attempt to share my screen here, and we'll see if technology cooperates so that we can share our presentation with you here.
I'll just add, appreciate you all bearing with us a bit. Chris and I are obviously in two different locations, so we'll see how this goes, but hopefully it'll go along smoothly, and I'll echo that. Thanks for having us here.
See, Sophie, is our screen shared? Can you see the PowerPoint? Okay, cool. It's working. Yeah, everyone. Thanks again. Thanks so much for having us. We are Chris Collins. I'm joined by Sophie Novack, and we're reporters and editors at the Texas Observer, a statewide publication based in Austin. We spent about 5 months reporting on rural healthcare in this series called Critical Condition. You'll see a link for it at the bottom of this page if you'd like to go check that out. Essentially, this series comprises 3 major stories. One about physician shortages, one about hospital closures, and one about reproductive health care. But there are also some other kind of ancillary type of content. There's some Q&As, there's some maps, things of that nature that you guys may also find useful. We clocked a lot of miles on the road and a lot of time on the road doing this. We went to the Panhandle, to West Texas, to far West Texas, to various parts of East Texas, and we met a ton of interesting people and had some eye-opening experiences. And we heard probably some stories that are similar to stories y'all have heard with regard to the sorts of situations people find themselves in when they don't have access to healthcare or adequate access to healthcare in some of these rural areas. And we're going to share some of those stories with you today. We're not going to get super bogged down in statistics and facts and things because most of you are already aware of those. But we will just briefly here at the beginning delve into some of those top line statistics because they are important. But we're going to spend most of our time here telling you about some of our experiences we've had, the people we've met, because we think that's really important. And that's really what makes up the heart of these stories. And those people are important, and especially the ways in which they're affected. So Sophie's going to talk a little bit about our motivation for the series, a little bit about why we decided to do this, and some of the aforementioned statistics here.
So yeah, Chris touched on this a bit already, but I would say, we going into this knew that rural healthcare was in crisis around the country, and especially in Texas, that a lot of the challenges being faced by rural providers and rural hospitals were particularly clear in Texas. And so our goal here was really to kind of put a face on what that kind of dearth in care looked like in some of these areas. So, you know, we knew a lot of these statistics, as I'm sure most of you do as well. At least 20 small town hospitals have closed in Texas since 2013. That's nearly double the number of closures of any other state. And about 1/5 of the total number of closures around the US during that period. More than 1/5 of Texas's 254 counties have only one doctor or no doctor at all. And many cash-strapped rural hospitals have staved off closure by shuttering their maternity wards. So of the state's 158 remaining rural hospitals, only 66 still deliver babies. That's according to the Texas Organization of Rural and Community Hospitals. And more than half of Texas counties have no OB-GYN. Many Texans have to travel hundreds of miles to access any kind of basic reproductive health services. So I'm sure that all sounds very familiar to you. We kind of started from, you know, the knowledge of that kind of a situation, and went into this project really wanting to see what that actually looks like on the ground. Who are the people being impacted by this? And really kind of highlighting what that means both for folks living in these communities as well as the towns themselves. And also to highlight what elected officials could be doing to help. I'll pass it back to Chris.
Yeah, so what do these top line statistics mean? Like what is the actual effect on the people and in the places? And here's like, you know, we drew quite a few determinations from the conversations we had and from the reporting we had, but I think these are probably the three most important. So first and foremost, it is much easier to close a hospital than it is to get one back. We saw hospitals be closed in several of these areas for various reasons. I mean, it all tied to finances somehow, but the specific reasons differed from place to place. But generally speaking, the places we visited used to have a hospital, and generally speaking, now they do not. And there were efforts in almost all these places to try to get some semblance of healthcare back. And some places were more successful than others, but it is, once you lose your hospital in a rural place, it is very, very difficult to get that level of care back. And even if you are able to get some level of care back, it likely will not be the same. And it leads to some of these outcomes that we're going to discuss further in the presentation. Another thing is that a lack of healthcare in a rural place, what we found is it has a larger effect than just an effect on the physical health of the population. It really affects the entire place. It affects the economic well-being because, as y'all know, hospitals are often the biggest or the next biggest employer in an area. It affects mental health. You know, people may be stressing about not being able to get to the doctor if they need to get one. It not being able to get the care they need, especially if they have recurring health problems. And I think this is something that we tried hard to get across, this idea, because it is a bit nebulous, but it really affects the morale of a place. When you don't have adequate access to healthcare, when you don't have the doctors, when you don't have the hospital, it seems like the community kind of starts to shrink in on itself. You start to lose hope, is kind of how I would put it and how we would put it. And it's kind of like a domino effect in these places. It affects more than just the physical health and being able to access healthcare, I think. And the third thing is that, for the most part, pretty much everyone we talked to wanted better access to healthcare. There are a few exceptions. A few people we would run into every now and then who are pretty fatalistic about it and say, well, I'm going to do the best I can. If I get sick and die, then that's what happens. But that was a pretty rare attitude. Generally speaking, people really do want better access to healthcare in these places. Thing is, not everybody agrees on how to do that. Just as an example, as far as expanding Medicaid through the Affordable Care Act, which is one solution that's been explored to get more people insurance and reduce some of the economic burden on these hospitals and doctors and uncompensated care cost. Not everyone agrees that that's the best course of action, and especially in these rural places, which tend to be overwhelmingly Republican and elect Republican officials, that party is generally, and this isn't true for all Republicans or anything, but the party has generally resisted expanding Medicaid through the Affordable Care Act. And so there's some disagreement on how to fix the problem and how much the government should intervene, as opposed to trying to attract private industry to try to fix those problems. And now that that's out of the way, let's get into kind of our first case study. This one is about hospital closures. And for the most part, we set this story in Clarksville, Texas, which is in Red River County, and this is in far northeast Texas. So this photo that you're seeing here is a picture of the hospital that used to be in Clarksville that no longer is. Just a little background on this. There once was a group that operated several hospitals in East Texas, and it was the East Texas Medical Center. In 2014, they ran into some economic problems, and several of their hospitals that they operated in East Texas were shuttered. That included the one in Clarksville and other nearby ones. One in, I believe it was Gilmer, and one in Mount Vernon. That are in fairly close proximity to this. As it stands now, people who live in Clarksville who need emergency care specifically have to be rushed to Paris, Texas, which is quite a trek to the west, and sometimes they do not make it. And we interviewed several people who had loved ones die in medical emergencies simply because they were not able to get emergency care in time. And it seems likely that if they had been able to receive emergency care in their own hometown, they may have survived. At least that is the theory of their family members. Some function of these closures appears to be, it's hard to say what percentage of the contribution this is, but some contributing factor may be uncompensated care costs. In the year these facilities closed, the 3 hospitals in that area reported $2.9 million in uncompensated care costs. So they were shouldering the burden of treating the uninsured. There is a doctor who, in Paris, who's trying to revive the hospital in Clarksville. He's been trying for years and years to do this. Sophie and I had the opportunity to sit down and look over his extensive plans for resurrecting this place, which would be on the same site as this photo you see here. And we were able to tour the facility and see his vision of, like, here's where the elevators will be, here's where the cafeteria will be, here's where the circle drive will be. His plans to have cardiac operations, so here's where the cardiology program will be, and those types of things. So he has big plans for this. Unfortunately, he's kind of run into hurdle after hurdle, obstacle after obstacle, and trying to realize those plans, and which is a shame, because there are a lot of people who are counting on him to be successful. And here Sophie is going to discuss some of the people that we had an opportunity to meet and who had some experiences with having loved ones pass away because emergency care was not close enough.
So this here is Courtney Bogan. She is on her phone holding a photo of herself and her mother, Gayla. We met with Courtney at one of the nursing homes in Clarksville, which is where this photo was taken and where she now works as a nurse. We talked to Courtney about her experience a few years ago in December 2014, just about 2 weeks after the hospital in Clarksville was closed. Courtney got a call from her brother that her mom was at home in Clarksville having trouble breathing. She rushed over to her mom's house. They called the ambulance. Her mom, Gayla, was 47 years old at the time. They didn't know it then, but Gayla was having a heart attack. And she was rushed to the emergency room in Paris, Texas, which, Chris mentioned, a bit of a trek, about a 30-minute drive, rather than the just a few minutes it would have been had the hospital still been open in Clarksville near their home. Gayla ended up not making it. Her heart gave out in the ambulance just before arriving at the Paris hospital. Of course, we don't know what would have happened if the hospital was still around in Clarksville, but Courtney told us that she can't help, even now, but wonder if her mom would still be alive if the hospital in Clarksville hadn't shuttered. She said to us, what if we had a hospital where she could have gotten stable? We don't know, but not having a hospital close started what I feel like is a string of people not getting to the hospital fast enough. According to the only full-time physician still practicing in Clarksville, who we met at his clinic, which actually is directly next to the old Clarksville hospital, where he used to work, and that commute used to be really quick for him. According to him, longer travel times to Paris may have contributed to at least 10 patient deaths since December 2014 when the hospital closed. And he predicts more preventable deaths without a hospital close by. Next slide, please, Chris. So this here is a Red River County Judge L.D. Williamson in his office in Clarksville. Williamson has been fighting to see the Clarksville Hospital reopen for years now. So we met with him there to talk a little bit about those efforts and what it's been like for that hospital to not be around anymore. And as a bit of a kind of example of how prevalent this issue is, it came out later in the conversation as we were talking with him about whether he knew residents who had passed away en route or shortly after the drive to the Paris hospital. He eventually told us that his wife had died in July 2015 of a brain aneurysm after driving to the hospital in Paris and then being transferred to a hospital in Plano. Again, we don't know what would have happened if the hospital in Clarksville was still around. But Williamson also still wonders if his wife would be alive if that hospital were still open in 2015. He told us we'd have gotten there much quicker and the damage would have been a lot less. So these kinds of stories are known across Clarksville. We've heard kind of rumblings of these kinds of situations a lot throughout our reporting. And we also found that everyone in the town has an opinion, even 6 years after the hospital closed, on whether the new facility would ever actually reopen. So these days, Williamson spends most of his mornings at the local McDonald's, where we met him for the first time, and where a lot of Clarksville residents come to chat with him and to air their grievances, often about the lack of healthcare in their community. So the fear of not making it to the hospital in time is top of mind for a lot of folks who lived here. We've had a lot of those kinds of conversations. One person that we met at that McDonald's, a Clarksville resident, told us people didn't die in Clarksville. They died somewhere between here and Texarkana, here in Mount Pleasant, here in Paris. The obituaries today for Clarksville might as well say died in transit, died on the road.
Yeah, those are powerful comments, and we heard things sort of similar to that frequently, uh, especially in Clarksville. That was not an outlier at all, and these people really want better access to healthcare, and they at least want access to life saving healthcare that they currently do not have. Um, our second case study here focuses on physician shortages, another major problem when it comes to rural healthcare. And this portion of the series is set in Memphis, Texas, which is in Hall County, population 3,000. This is a photo of Memphis downtown. Probably looks similar to some other rural downtowns you've seen. Rural Texas isn't a monolith, of course. There are some rural places that are doing well, but a lot of them look a little bit like this, sort of deserted, not much traffic. Some of the storefronts are closed, things of that nature. And here in Hall County, they do not have a doctor. They've had some other healthcare problems, access problems that we'll get into here in a second. But I think maybe a better place to start before we get exactly into that is this special report to the legislature in the late 1980s. I think this will kind of set the groundwork, and then we can get into where physician shortages stand now. So in the late 1980s, this is when Bill Clements, still the governor of Texas, the legislature directed a task force to study rural healthcare in Texas. They went all across the state. They spent 10 months going to lots and lots and lots of rural counties. They took in a ton of testimony, about 100 hours worth, actually, and they finally reached a determination that the access to healthcare in rural places was abysmal. It was broken. There were hospitals closing left and right. Doctors were dying in rural places, and no one was coming to replace them. And that the situation was just really, really bad. And here is some very powerful language from the report. It reads, "More and more of our fellow Texans are traveling farther and farther for even the most basic healthcare services, or worse, simply doing without. If this sorry state of affairs were brought before a grand jury, there might be an inclination to indict the state and federal governments of gross negligence." Just to put this into context, when this report was done, 14 of the state's 254 counties, that's how many counties we have in Texas, 14 of those counties had no doctor. At the time of our reporting, that number jumped to 33 counties with no doctor. That's more than double. And as the task force made clear in the report, it was already really bad then. And so now it is worse. So I'd like to introduce y'all to Angel and Yolanda Narvaez. They are two of the people we had the privilege to meet when we were up in the Panhandle reporting on this. They're standing in front of what once was the health clinic, the only health clinic in Hall County. It is now closed. About 2 years before we started reporting this story, that clinic had closed. It sits next to the hospital that is not pictured, but there is a hospital nearby, and it is also closed. The clinic itself closed after the nurse practitioner who had run it forever, she decided, she was retirement age, and she decided to retire. Also in that time period, the only doctor, full-time doctor who was still practicing, had died. And the closest medical center to this is the hospital in Childress. So a little bit about their situation. Years ago, Yolanda had worked in the cotton fields. This is cotton country up there. And she had a job checking the traps in the cotton fields for the boll weevil, which is a destructive agricultural pest that you basically have to keep an eye on to make sure it doesn't wipe out crops. And so one day at work, she was driving through the farm fields, and the road in front of her had been washed out the previous night from a storm. And so she went down into basically this washed out portion, and it injured her neck in such a way where it messed up the discs in her neck. And since then, she's been dealing with chronic pain from that injury. And it's problematic because there's nowhere where they live right here for her to be treated for that. So she and Angel, she can't drive, and so Angel drives her. They have to take frequent trips, 5-hour round trips to Lubbock to see the doctor, to see the pain specialist, and to be able to get treatment for this. She's had problems with insurance covering these things. She's had problems with appointments being canceled and then wasting a lot of money on the trips. And it's hard to scrape up the money to do this in the first place, to make these frequent medical trips, because Angel has to take off work from his job at the courthouse to be able to do this. Here's a quote from Yolanda. She said, I guess it just comes, we're asking her about the lack of access to doctors in the area. She says, I guess it just comes from living in a small rural community. You don't get access to too much of anything. It's hard living in a small town, but at our age, I don't know that we'd make it anywhere else. Because we were asking them, well, would you consider moving somewhere else, somewhere with better healthcare? And it's not, I know that's something that people say, well, if your healthcare is not good where you live, why don't you go just live somewhere else where it's better? And it's not always that easy. There are other factors to consider when it comes to that. And so I think that's an important thing to note. Another person that we met, this is Dr. John Howard. And he's an incredibly interesting guy. He's one of the most interesting people that we met in our course of reporting on this story. But he is a medical doctor, a former flight surgeon in the military, and he's also a county judge of Donley County. And this is Clarendon is the county seat of Donley County, and he runs a clinic in town. It is the only clinic for 1,000 square miles. And it also, Clarendon, it's important to note, has Highway 287 running through it. So they see a lot of motorists, and because of that, they see the things that come from that, the traffic accidents, those sorts of things. And it's good for the motorists that John Howard is here, because of his expertise and being a former surgeon, he can a lot of times get people stabilized until they need to go wherever they need to go after that. Howard also kind of exemplifies another thing that we saw in a lot of these places, is that the people who live there many times have to wear a lot of different hats. So, he's been the president of various civic organizations. We attended a Lions Club meeting while we were there. He's a Sunday school teacher. He also runs the only clinic. He's also the county judge. He also, and that's the case in a lot of these rural places, is that these people who are still trying to provide some healthcare also do a lot of other things too. And he has kind of developed this really neat clinic there that we were able to tour and look at with him. And they offer a variety of services there. And one of the things he told us, he said, because we're the only provider in a county that doesn't have a hospital, we'll see just about anything. He's talking about kind of the range of cases and things that they'll see there. And another thing he pointed out that is pointed out a lot, I think, when we do reporting in the Panhandle, is kind of how little representation they feel and how little support they feel like they get from state authorities, from the people in Austin. They'll point out that, there are a lot of state capitals that are closer to us here in the Panhandle. There are a lot of them, probably 3 or 4, that are closer to us than we are to Austin, than we are to Travis County. And they think that says quite a bit about the level of representation and level of support they get, that they feel just so disconnected from state government and that support that they should be getting. We'll move on here to kind of our third case study. And this one is in reproductive health care, or lack of, reproductive health care in rural Texas. We're going to turn this one over to Sophie. She was really the driving force in reporting this story, so she's going to talk about this one.
I'll just add one of my favorite anecdotes of our time with, I'll say, Dr./Judge Howard was in the courthouse. He passed a patient of his, small town, and she said, "Hey, Dr. Howard." "Oh, I guess actually today, Judge Howard." We're in the courthouse, so never really know how to address him. Anyway, I'll be chatting a little bit about access to reproductive health care. So for our third feature in this series, we wanted to look at the way that the lack of access to a number of different kinds of reproductive health services kind of intersect and manifests. We knew that if we were looking to do a story on limited access to reproductive health care in Texas, that West Texas was the place to do that. And to narrow in on our location, we mapped a variety of different factors. So we mapped publicly funded family planning clinics, which counties had OB-GYNs and how many, hospitals, rural hospitals that still deliver babies, and abortion clinics. And we created this spreadsheet of places that were far from all of those different things. The idea being, where are the places that you can either prevent a pregnancy, deliver a baby, or end a pregnancy? And based on those criteria, kind of together with population in terms of the number of folks that would be impacted, we ended up landing on Ozona, which has a population about 3,200. Comes with the slogan, "Biggest little town in the world." This is right there on Main Street. And it is the only town in Crockett County about midway across I-10. So again, a pretty major interstate crossing through here, which introduces, a number of different kind of healthcare needs. So Ozona lost its hospital in 1996, leaving a single health clinic that offers limited reproductive health services. So people that are seeking basic preventive health care or prenatal checkups typically have to make a 170-mile round trip drive to San Angelo. Pregnant patients have to make the same hour-long drive one way to give birth. And the closest abortion clinic is in San Antonio, which is a 400-mile round trip. So one way that this lack of access to reproductive health care in Ozona has manifested is a remarkably high teen pregnancy rate. So Crockett County's teen birth rate is double that of the state's. There are 82 births per 1,000 females ages 15 to 19. And that's compared to about half, 41 in Texas, and then 17.4 nationwide. There is only one high school in Ozona and in Crockett County. Last spring, so not a couple months ago, the spring before that, that would be 2019, about 10 of the 96 female students in attendance there were either had or were expecting babies. So in a given school year, the high school principal estimates that 8 to 10% of girls in the school are either mothers already or are pregnant. This happens so often that helping students who are pregnant or who are new parents to make sure that they still are able to complete their coursework and graduate on time has become a huge part of the principal, whose name is Tamara McWilliams, a huge part of her focus and her job. So I was able to visit the high school there to spend some time with the principal there and just hear a bit about kind of how this has just become an incredibly kind of integrated part of the high school experience in this place. So McWilliams has really taken on this element of the job in a really real way. When families in town struggle to pay for gas to go to San Angelo for a prenatal appointment, McWilliams sometimes meets them at the local Stripe station to fill their tank. She's accompanied nervous teens to tell their parents that they're pregnant. She's talked to students about their miscarriages when that has occurred. And she has a multitude of programs in place so that students are still able to get their schoolwork done without missing too many classes while they're traveling for prenatal appointments, to deliver the baby, or to care for their new baby. So while I was at the school, McWilliams introduced me to Sabrina Salas, pictured here, with her son, Xavier. Salas was she just graduated in the spring of 2019, and she had Xavier that year. So this was a pretty remarkable story to me. At the time when Salas became pregnant, she really wasn't sure that she would be able to finish her coursework and to graduate on time. And at the time, there was another student at the high school who I also was able to meet while I was there, who had a young child already and then was also pregnant with another child. And so during that school year, McWilliams kind of came up with a plan that I think was pretty unprecedented. She said, I want to make sure that these girls are able to graduate. So she set up a table outside of her office in the high school, where the two students could work. And they could keep track of their babies at the time. They had a little playpen set up. And when they had to go to class to take a test or something like that, McWilliams watched the babies herself. So she spent a lot of time with Xavier here in the high school. And Sabrina was able to graduate on time. She actually now, I believe, has started now at community college in San Angelo. She decided that she wanted to train to become an ultrasound technician. So while we were reporting this story, did a bit of a tour around a lot of West Texas. And I also met Don Cockrell, pictured here. So this was another feature story that I wrote after our kind of 3 major stories in our critical condition series. And the focus of this one was in far West Texas, kind of around the Big Bend region. And this was focused specifically on access to maternity care, and on like her. She is a traveling midwife, so she is based in Alpine, Texas, but she does prenatal visits, home births, and 6 weeks of postpartum care over an area spanning thousands of square miles. So down to the border, all the way over to Hobbs, New Mexico. She delivers in Midland, Odessa, et cetera, et cetera. She's delivered babies on RVs, on remote ranches. She even delivered a baby a few years ago inside Big Bend National Park. So the hospital in Alpine is the only one in a 3-county area of more than 12,000 square miles, which means that folks who are pregnant sometimes have to travel more than 100 miles to give birth there. Sometimes they don't make it in time. So I spent time with some doctors who were telling me about, talking to the pregnant person's partner, saying, okay, just in case, here's what you're going to need to do if you end up having to deliver this baby on the side of the road. So that idea with this story is kind of looking at the role of, or the potential role of midwives when we're thinking about lack of access to maternity care in rural areas. Of course, kind of I suppose one of the theses of this story is that this kind of rural health vacuum has created this kind of catch-22, where midwives like Cockrell could help fill in maternal health care gaps for low-risk pregnancies. However, longer travel times to hospitals make home births or births at birthing centers more risky if something does go wrong. And then I'll turn it back over to Chris now. And I think to close this out, we're kind of bring it to present day here. Obviously, the COVID-19 pandemic has exacerbated a lot of these concerns that we're talking about in rural areas in Texas. And we have had the opportunity to kind of check back with a lot of the folks that we talked to in this series to see how they've been doing with the pandemic. So Chris will start us out on this now.
Yeah. Unfortunately, we're still stuck in pandemic times here in Texas. It's gotten worse. It started. You'll all, I think, remember early on in March, April, early April, it seemed like a lot of our rural areas were going to be spared, or at least come out somewhat, mostly unscathed from the pandemic. That has not turned out to be the case in a lot of rural Texas. The rate of infections and the number of infections and cases has gone up in a lot of these places. Not connected to this series we're discussing today necessarily, but still connected to those ideas. We've seen these same problems: lack of hospitals, lack of doctors, lack of health insurance, exacerbate that, like Sophie said, because it's just another kind of medical care that you need, another kind of access to care that you need that these communities aren't having. We've been able to link some of these growing infections in rural Texas to nursing homes, which have been very hard hit, to prisons in some of these areas, especially in East Texas, I think, and also meatpacking plants in East Texas in the Panhandle. Some of those in Moore County and in the Amarillo area have been publicized fairly heavily. There's also been some outbreaks in East Texas, close to Louisiana border, we've written about, that have been particularly bad, and in those areas also have had perhaps not as much access to healthcare as they've needed. The good thing about having already done this series in which we've examined these things and met and talked to a lot of people is we've been able to kind of keep going back to them and seeing what their experiences were and how they're dealing with this current situation. In a lot of cases, we've heard some frustration about how little data and how little information these people are getting from the state, and to be able to react. You know, if you're a county judge, for example, you need to make some decisions about what your community is going to do in these times to not spread the virus. And in some instances, the people we've talked to, we found that they're not getting up-to-date data or accurate data about the number of infections in their communities, or at least they weren't when we talked to them. And so that's complicated. It's made it more difficult for them to make the decisions that they need to make. And we'll find a way to send this to you or link it or something. But Sophie relatively recently wrote about rural Texas and COVID. And there are just some staggering statistics there, specifically regarding the lack of intensive care beds in some of these areas. Hospitals are filling up like crazy, especially in South Texas and especially along the coast. And the number of beds for the sickest people is dwindling very, very quickly, getting dangerously close to zero in some of these places. And so that's really scary. And it spells more trouble for rural Texas and for people being able to get access to healthcare there. So that's kind of the situation we're in now. Let Sophie add on to that if she'd like to. And then after that, we will move on to questions.
Yeah, I'll just add a bit onto there. I think there are a lot of metro hospitals that have been getting a lot of a kind of public attention, government attention recently, particularly in the Houston area, where hospital beds are really filling up, which of course is very important. But I think there's an important connection to rural Texas there, which is that obviously a smaller, we're seeing surges as well in rural areas, and a smaller outbreak in a rural area can more quickly overwhelm the system in that area. And also a lot of these rural hospitals rely on these larger metro hospitals to be able to transfer patients if needed. And so what we've been hearing from some hospital executives in rural areas is that that's becoming more difficult as these urban hospitals fill up too. Just to quickly bring it back to a couple of the folks that we've talked to in this about earlier, now in this context, I think I'll call out Red River County as one where there really weren't very many cases in the beginning of the pandemic. And suddenly later this spring, those started to rise really rapidly. I believe their latest case count is 130, which is not one of the highest per capita in the state, but a good number in a county of 3,200, and particularly one that doesn't have a hospital. And I think we're seeing other kind of elements play out there as well as in other rural areas. So there's also particularly limited access to COVID testing. And also a lot of these areas don't necessarily have their own health departments. And so a lot of the kind of response is falling to local officials to kind of do some of the contact tracing, et cetera. And so what we were hearing from Williamson and Red River County now is that a lot of those tests are taking more than a week to come back, and they're not able to do the contact tracing themselves. Their hands are being kind of tied by some of the bureaucracy from the state. And then I'll kind of bring it quickly back to Dr. Howard. I think this is a pretty interesting example of it really Donley County being very fortunate that its county judge also happens to be a doctor. So because of that, it seems that Donley County, which early in the pandemic actually had the highest per capita rate of COVID cases in the entire state, they've really staved that off. I think there have only been 30-something cases total in the county. And a lot of that seems to be related to the fact that as a doctor, Dr. Howard was able to set up the kind of testing infrastructure, has been able to know more quickly when folks are testing positive in his community, because he's both testing those patients himself as well as getting other information of other patients directly from the state as county judge. So I think there are a number of different ways in which the pandemic has highlighted kind of different challenges that rural areas are going through that we looked into in this series. That's just kind of a few of them. But it really has been striking to kind of get back in touch with folks that we talked to for this series to see how things are going, and to really see pretty significant surges of COVID-19 in a lot of the areas that we visited that are, pretty sparsely populated, lots of space, and are not necessarily places that I think folks expected to see big outbreaks kind of early on in the pandemic. So I think we'll close there and take any questions that anyone has.
And also, if you would like to contact us at email questions, we probably should have put our email addresses in here, but perhaps to figure out how to put that in the chat, or somebody with the organization can do that. But we would welcome any communication from y'all also via email. Though we'd love to be able to field some here today too.
Do you think that you'll be doing a follow-up series possibly about the COVID pandemic in the rural areas, the impact it's had, and also whether or not there are going to be changes made that could be of long-term service or benefit to the people in rural Texas?
Yeah, so I think going into this series, the idea was that we had these kind of three main features planned out along with a number of other smaller stories, but that it would really be an ongoing project. So we kind of have this broad umbrella of rural healthcare reporting that we're working on, and we've continued to do that since this story has published. This series published. And so, yes, definitely. In the last few months, a lot of our coverage has focused on COVID-19, and I think Chris and I, in particular, have really focused on rural Texas and the impacts in those areas. So, happy to share any links to those stories we've done already, if that's helpful, in terms of how things are going with COVID-19 in these areas. And then, yes, absolutely plan on continuing that kind of reporting moving forward.
Excellent.